Hi, Hi, I'm the Sjogren's sojourner. And the first thing you're going to ask me is, why did you tack one unpronounceable word onto an unpronounceable, actually phonetically terrifying disease that even though, like in my case, I'd had it for, I don't know, 54 years before I could pronounce it. Well, that bears qualifications. So here's where I'm coming from. For one thing, I think that Sjogren's Sojourn is a good name because if you can master that and say it like 85 times fast, the brain plasticity factor of regeneration will kick in and our problems will be over. I haven't gotten there yet. I just think that there's no, I have made a career in some cases so I'm looking at what's available in the way of information and encouragement to Sjogren's patients who I think have to have it the worst in terms of the cracks that we fall between in several different directions. And I'll tell, boy, I've got quite an odyssey from when I embarked on, declaring that there's something seriously wrong here, it's not in my head, in 1983, to diagnosis 2 months ago when I was, not to put too fine a point of it, 1 foot in the grave and about 3/4 wackadoodle from the effects of it. So it's a real gaslighter disease, and it's unfortunately something that the medical profession, even at the specialist level, is fantastically not up to date about and in outright denial, and they really don't want to hear about it. So most of the people, if not all of them, that I have known to be diagnosed have figured it out themselves and had to pursue it. Whereas like, well, it kind of acts like this, it kind of acts like that, but there's nothing we do anyway. No, and that's all incorrect. There are many, many, many myths and just mistakes made all over the web at doctors, rheumatologists, ear, nose, and throat doctors, dentists, oral surgeons, ophthalmologists. They think they know a little bit, or they don't want to much be bothered with it. They'll prescribe you drops or something, but they don't want to be bothered with the diagnosis, rarely. And you've got to be a bit aggressive. When you find your way to a rheumatologist, you may find that you may find yourself stymied at his refusal to really prescribe what is known to work, or at least would not hurt, based on even when you find your way to a rheumatologist who is going to have to be your the captain of the team here. They don't know the latest thinking on this. They may refuse to diagnose Sjogren's or anything else, and they say, well, there's nothing I'd really do, They'll dance all around it before they really call it what it is and deal with it, and there's a reason for that. So I've lost so much ground and so much of my life to this disease. And I have been gaslighted, not by the disease, just by the disease itself, but by doctors, family members, who, they don't like it. They think it's your attitude. You'll be told that. and because you're just not all there all the time. Sjogren's patients are up against something that I'm not sure is that active with the other autoimmune diseases, maybe to some extent, but for just pure old blinkiness, I don't think any of the others match Sjogren's. From one day to the next, you may look the same, and you're just, your IQ is about 30% of what it was the day before, and people get very angry with you. So I'm as much or more interested in the now, I think there's no dispute in any camp that I know of that if you get underneath a Sjogren's person, get underneath our emotions a bit, you're going to find some serious trauma. And I'm as much or more interested in just pointing it out. I'm not a therapist, I'm not a psychologist, I'm not a medical person, I'm a journalist, and I'm a Sjogren's person. And I'm something else too, I forgot. Oh yeah, I did, I spent a couple of pretty intense years doing medical journalism, popular journalism, and I became pretty well informed about a lot of stuff and learned some research skills. So I think that, my lack of categorical, so I'd like to submit to you that so I think what I'm bringing to the table here is my lack of qualifications, except as a journalist, is someone who has literally done a whole lot of work as a journalist in one incarnation of my career as being the bridge between doctors and patients and explaining them to each other, putting the doctor's side of the equation into language the patient can understand and helping the patient move forward. So now I'm doing that for myself, and I'll tell you what, if I hadn't been a little bit better educated and a little bit more aggressive and a little bit more just lucky, I made it through this far by the skin of my teeth. Sjogren's has nearly taken me out a couple of times in my life. It can be quite lethal. It gets you in other parts of the body. It can damage other tissues and organs. And I'm new at this. Like I say, I'm not an expert. I'm an expert at being an amateur. I'm an expert at talking to experts. I'm an expert at what I've experienced. So, and I don't intend to go too much beyond that, except what is readily apparent in research. So, here's my test run. If you made it this far, I'm truly applaud your fortitude. Adios.